small and intimate grouping because I can't see any of you. I feel a little bit like I'm speaking into the kind of void, but hopefully we'll be okay. So for people that I don't know or don't recognise me, my name's Neil Shaw, as Kate said. I'm the Chief Exec of Rossendale Borough Council. As she also said, welcome to this little afternoon session briefly on good mental health and achieving an effective work-life balance. It's a subject I'm really interested in and really passionate about personally. And for a few minutes, I thought I'm just going to give you a really brief perspective on the issue from our experience at the council. But then what I wanted to try and do was move us on to discuss some of the issues surrounding this topic. And during that discussion, in a few minutes' time, I'd be really interested to hear your experiences, your ideas, and your views on that issue. So I've spent quite a bit of time on this in the last year or two, and some of the research we've done indicates that maybe as much as 1 in 4 people experience poor mental health during a year, the last year or so, and maybe around 1 in 6 people in the country report experience some sort of mental health problem, whether it be such things as anxiety and depression, for example, every single week. I think it's really good news that mental health is on the agenda. It's a topic that is of increasing kind of conversation, increasing interest to organisations, and I think it's really important. I think it's also important to say the COVID pandemic has clearly created some new working arrangements for many businesses and different kinds of stresses for some employees. We're in unusual times. Here at the council, our staff engagement activity, and we do a regular staff temperature check, a sort of staff survey. We did one over the summer, and that pointed us to some interesting messages around mental health and work-life balance. This included a great number of staff feeling socially isolated or lonely from time to time working from home. And probably numbers might be able to identify with that. The importance of regular communication and reassurance from management, and some signs of increased sort of what I think I would call lower level anxiety around health and welfare, which I think is understandable if you don't have necessarily day-to-day contact with your manager and your work colleagues. So even in normal times, whatever they are nowadays, I think these issues obviously exist, and we're going to explore what we mean by good mental health at work and issues around achieving an effective work-life balance and what works for both the employer and the employee. I think both aspects are really important. So what are some of the signs from our perspective of maybe an unhealthy work-life balance? We had a discussion in the management team recently about this, and we identified a few kind of key points, I think, which I'll just summarise quickly. One was around people neglecting other aspects of their life, whether that be spending time with their family, in other words, less time with their family, or things that they like to do, like hobbies and interests. Clearly, people working longer hours, I think, is a sign of a poor work-life balance often. Anxiety around completing tasks, so people working over weekends. Well, I think like some examples of people sort of losing sleep, literally, around anxiety around completing a project or a report or a piece of work to a time scale. And for us, I think we found tension around people with competing life roles. So where people have got caring responsibilities, childcare, and obviously the challenges, for example, of working from home, and the last over the summer period, people not having children at school, trying to kind of spin a lot of plates. I'm personally passionate about creating a culture at this organisation where staff can achieve a healthy work-life balance. I think it's good for business fundamentally. Better work-life balance means we have staff who are mentally fresh, less anxious, and critically for me, they're happy. I think it's understated too much. I think it's really important that we spend a lot of time at work, and I want people to enjoy it, largely anyway. I'm not saying they enjoy it every single day, but I want people to be pretty happy. So before we just move on to the discussion, I want to briefly share some of the council's ideas around how we might achieve this in practice. I think people are always interested in, what do you do in a practical sense to make this happen? So for me, there are 5 specific things we think are important in terms of mental health and good work-life balance. The first one's around us as senior managers creating the right culture at work. We need to set the tone. So managers who work late or place unreasonable expectations on staff shouldn't be surprised if staff suffer. Senior managers like us should and hopefully do role model those kinds of behaviours that we hope to see in staff. we try to sort of walk the talk and do it ourselves. We think we set the tone. Secondly, for me, it's about having a more outcome-focused approach. I've worked in an organisation which is very process-focused, so I'm interested in what our staff produce and how this meets the needs of our residents. I'm less interested in some of the process stuff, if I'm being really honest. I probably shouldn't be, but I am, if I'm being really honest. And I'm more relaxed about things like what time people start work, what time people finish work. Different things work for different people. I'm keen and clear that we need to work more flexibly, and I'm more flexible in terms of my expectations around that and be more outcome focused. The third thing for me is about having clear expectations. I'd like to think we, as managers, set clear expectations and reasonable expectations around things like workload, tasks, and timescale. I try and make this a two-way discussion. I think staff generally have a better understanding of what's realistic and what's doable in terms of task completion, and we should listen to them more rather than dictating and having a top-down approach. Fourthly, what I'd call regular dialogue. So communication is really clearly important. Spotting early signs of things going wrong is really critical. Building in opportunities to regularly talk to people and to listen to what they say. Explaining the reasons for the urgency of a task, for example. And for me, not everything can be a priority. I have a number of managers who have a priority and next week it's another, everything's a priority whenever they talk to me. It's not possible. And lastly, for me, it's really important, fundamentally, work is secondary. I know it's not a universally popular view from businesses and from organizations, but people come first. And we should remember that work is not the most important thing in people's lives. Certainly shouldn't be from my point of view. Letting people spend an appropriate amount of time on work is important. Different people cope with the same workload in different ways. And for me as a chief exec, I have to constantly remind myself not to expect people to work at my level or my understanding or my pace. And I have to be a bit more tolerant of that. And the rest of people's life is much more important. So it all sounds wonderful working at the council, doesn't it? This is not a recruitment drive, by the way. It sounds like a horrible sort of cross between a sort of an advert for an organisation and a horrible dating profile. So let's try and move on for the bulk of our time to have a bit of a discussion. I'm really interested in the sort of the two-way stuff. So I've got a couple of questions to facilitate this, I think, if we need it. But I'd really like to begin by hearing other people's experiences of mental health and work-life balance and understand what it's like at their workplaces or what their experience is like. So what's it been like for you?
Neil, are we talking sort of like in the current situation with COVID going on, or are we sort of like putting it into that context?
I think that's a really good question, because I've been wrestling with that a little bit. You know, what's normal and what we've been doing for the last 7 months or so doesn't seem to be normal. I think a lot of people do naturally are interested in the current, but I'm also interested in normal circumstances and whether there'll ever really be a normal, because I think there's a lot of discussion in our organisation about, I think, work and work-related experience and how people undertake their roles will be different, I think, in 2021 onwards. But how have you found it during 2020 with everything that's going on?
Personally, I found it really quite challenging. I live on my own. I'm usually very, very active. And when we try and sort of like compare 2019 to 2020, the world's just seen poles apart. All the sort of like sports and social activities that I did had to stop. You know, I played badminton, I was in walking groups and things like that. So for when COVID hit, we worked for both me and Matt were colleagues. And when COVID hit, we had to move from our work base, which was for me a lot closer to home. But understandably, we moved to a new building, which is so big. It facilitated us to be able to socially distance. And for me, mental health wise, it was good because I still had a routine. I could get up in the morning and I could go to work, and I had contact with people during the day. I don't know if the other option had been sort of like having to work from home. I really don't know how I might have coped with that, whether I had have had the discipline that goes alongside it. But actually having a routine of coming into work and being with people, at least for, part of the day, is a big thing for me. Funny, we are quite busy at work. It seems a little bit sort of like ironic that this talk is about work-life balance, and we've literally been shoving our dippers down our neck at our desks and not away, taking some time. But I think COVID and working this way, working virtually, meeting virtually and having these Zoom meetings and things like that, I think that's going to continue to be the way a lot of businesses work. I think a lot of businesses will still have their employees working from home. So I think, after COVID 2021, I think, the new norm will be a different working environment to what we're used to. And it'll have its, advantages, but still probably some disadvantages too. Or maybe not disadvantages, but not the way you'd prefer to work if you did have a choice about how you would build your ideal work environment around you.
The routine thing's really interesting, isn't it? So people who are, it depends on the nature of your job, doesn't it? But I think we're creatures of habit, aren't we? So we like a bit of routine and we like a bit of clarity. So if we work from an office, we know the people we work with, we kind of like the social aspect of that. You kind of communication flows a lot better. You kind of find out more things.
Yeah.
And I think the social contact bit of work is much underrated. So as well as doing your work, having people to talk to, enjoying hopefully working with the people you work with, and some of the good humour that comes with that, I think has been really knocked in 2020. So loads of my staff to say the same.
Yeah.
So you used to sit in an office with 6 or 8 other people, and all of a sudden, literally overnight, it's I'm working from home. I've never worked from home before. I'm kind of I think people struggle to adapt to the working from home bit. It takes a bit of a different mindset, doesn't it? And interesting, I think, how I've talked about communication for our managers. The ones that do it really well, there's regular, people phone each other regularly. They have Zoom meetings, they have virtual team meetings. And I have 2 or 3 managers who, if we're being really honest, are not good at that and don't feel comfortable with that. And so they've sort of let their staff sort of drift a little bit. They do everything by email. And then when you talk to the staff, they sort of say, look, I haven't really, in 3 weeks, I've talked to like 2 people. And it feels strange. It's also interesting if you live on your own. So people who live in a family setting, you've got the social contact there, but I have a number of members of staff who live on their own. So if you live on your own, you're in lockdown and your manager doesn't talk to you very much, it can be really lonely, and people don't. I think that's been underrated, or underestimated. And I think it depends if you're a people person or not, because some of our better managers really take time to talk to people and reach out and communicate, tell them what's going on. And others are very sort of task oriented. It's like, there's your job, there are your things you've got to do the next week. Just get on with it, and only contact me if you've got a problem. I don't know how have you found that sort of thing?
Yeah, I mean, say bringing us together from my perspective, particularly, I was in a smaller team, and we were brought to this building. So we've moved from a small team to working with a bigger team. So you actually see other people's anxieties as well, and that you wouldn't have normally seen. You're working with people that you wouldn't
How do you
normally.
spot that? That's interesting for me. How do you spot that kind of issue?
Well, the different anxieties have manifested in different ways. Some people become very quiet, other people sort of like, make more noise. There are sort of like times when, I think my behaviour isn't sort of like as professional as I'd like it to be sometimes, because I've found myself getting quite frustrated as well. I think right at the beginning of lockdown, in March, I think it was for me, it was easy to cope with because I felt that the whole nation was in the same situation. We had one set of rules and it was easy to follow. And then I think as time's gone on and more like localised restrictions have come into place, and people that you work with come from all different areas. They're not just people that live down your street, so they're under the same umbrella. And you find that, some people could do things and you started to feel a little bit aggrieved that there might have been a bit of freedom there that you didn't have, or vice versa. So it's, I think in one respect, we've got a lot of people that are looking out for their work colleagues. We really have. And there is a camaraderie there that wouldn't have been there before, and that's nice to see.
I think also, sorry to butt in. I also think we can take that camaraderie for granted as well. It becomes a normal. I know my wife's working from home and she doesn't enjoy that. She is at home trying to juggle childcare and getting tired very quickly, very easily, and not really being able to focus on to work. For me, I've only worked in the NHS since March, so this is normal for me. I haven't known it any differently, which may be a blessing. I don't know. I'll take it as a blessing for now. But my background before healthcare was hospitality, and it was very much, I've got a young family and they were very much on the back burner for a few years at least, and work took priority every time over that. And it got to February when I was in not the greatest place. I was lost at work. I wasn't enjoying it. And then the pandemic hit, which is obviously very horrific, and the consequences that's had on everybody's life over the past 8 or 9 months has been immense. But for me, it was a bit of an eye-opener. I was furloughed. I got to spend time at home and spend time with my kids and my wife, which was a novelty at the time, and that forced me to look for something else. And that's when I fell into the NHS and came here. But coming to work is a blessing. You get to come and see your friends, have a laugh. You can de-stress at work a little bit by talking to your colleagues and go home at a normal time. Not feeling like work is, when I worked in hospitality, it was very much that you felt you had to check your emails when you were home. You had to make phone calls when you got home. But working within East Lancs hospitals, it doesn't feel like that. You can go home and enjoy your time. You don't feel like you have to look at your phone every 10 minutes at emails, or it's actually frowned upon if you do that. And rightly so as well. I think that's a good culture to set, is that your home time is your home time. It's not time to look at your work emails and things like that. So yeah, for me, it's just been very much, it's going to sound horrible, but very much a blessing that this all happened and woke me up a little bit.
So it's interesting, isn't it? Sometimes you kind of bobble along day to day, week to week, month to month. I certainly did this. I don't know if I'm getting old, but in my 20s, I worked for what's now Santander. And in retrospect, I really hated it. I didn't know that at the time, because I was just kind of going to work. Work was work, and you just kind of went there. And it was only, I went on a really long holiday. I remember just thinking, I really hate that work. I was really dreading going back. So I think some of it's around, in terms of mental health and work-life balance. First of all, do you do a job that you like doing? I'm not expecting everyone every day to kind of come in smiling and be loving it. I don't know, I'm a realistic, but I think generally, if you can take a step back and go, yeah, I actually quite enjoy what I do. It gives me sort of sense of worth. Kind of like the people I'm working with, I like the stuff I'm doing, I like the amount of time I'm spending on it, etc., etc. And it's different things for different people. But I do know, first of all, an awful lot of people who feel trapped in a job that they are really unhappy with. I've got close friends, I've got my brother feels exactly the same. It's like, I've got to a certain age, I've done this for so long, how am I ever going to do anything different? How am I going to sort of change track? But I mean, I think I would say to people is, we spend a lot of time at work. We just sacked someone recently. This is really interesting. It sounds like a negative story, but we sacked someone, and when we talked about, I mean, they were really poor performing member of staff, but when we talked about, a lot of that is rooted in, they just don't like their job. And I remember, you kind of, as a manager, you go through all the formal bits about, performance and this, and I remember just sitting back and just saying, if you really hate it so much, why don't you go do something else? And I said, I'm not saying that as an employer, I'm saying that as a person. And they phoned me a couple of weeks after that and was sort of saying, actually, yeah, I've been really thinking about, what I want to do in life, what kind of job I want. So sometimes doing something you really enjoy, even if it's less pay or it's different, is a bit scary maybe, it's really important because we spend a lot of time at work. And I think the other thing for me is there's a big thing about what's the line between work and the rest of your life. I think working from home has helped to blur that line quite a bit, and certain jobs like hospitality is a really good example. You're constantly, but it's like you're never off. You sort of, even after a certain time, it's like, you're expected, evenings and weekends to look at emails or respond to work or complete tasks. And it's that sort of 24-hour culture, I think, is really unhealthy for us. So you need a bit of a coping strategy or an approach to sort of say, I'm not at work now, I've logged off or I've finished. I have a big thing about logging off at the end of the day, not reading my emails generally, not always in the evening. When I go on holiday, I don't take my work mobile phone with me, which is a risk in it, I think. But I just think it helps me a lot. Just think, I'm not at work. You're not paying me to do this. This is my time. Work is only there to give you the money to do the things you really want to do with the rest of your life.
Neil, could I ask, and colleagues on the call as well, are there any other kind of practical bits that you've kind of implemented or have seen elsewhere that particularly help with some of those challenges? Really like tangible bits, because the 5 points are really interesting, and I was wondering if there's anything sort of.
We did a practical. I can maybe start by saying we've done a practical thing. We haven't quite achieved it yet. It's taken me 11 months to not achieve this so far. It's to get rid of the clocking in machine. I really hate the clocking in. We have a very old school 1950s style or 1970s style kind of clocking in process, which I really hate. I think as a point of principle, I don't like it. I do get my HR manager keeps telling me why there are practical reasons why we have to do that in terms of time recording and blah, 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 blah. But I think there's a lot of psychology to a clocking in machine. It's like, I am now at work. I am now not at work. But it doesn't work like that in practice. People still do work outside of those hours and still do, we have loads of people who don't have a proper lunch break, have the sandwich at the desk. So I'm trying to get rid of the clocking in machine, but I'm also trying to make people have their lunch hour. And I think that is a really difficult one. It's interesting how many people don't want a lunch break. But I think having a lunch break and going for a walk or going to the shops or whatever you like doing or reading the paper, even if you do nothing, put your feet up and read the paper, I think is really good for you.
Yeah, I think there's something that it is really good for you. I think what makes you less likely to do that is if you're desk-based, I think, even though you might sort of like break from your work at lunchtime, you're still on a computer and you might be checking your personal emails or, going online shopping or something like that. I think if you've got like a manual job, you're more likely to literally down your tools and go and get a brew and a sandwich and maybe read the paper. I don't know.
I laugh because I have to go out to get it. Because I eat the sandwich and people come in, I've got a sandwich in my mouth, I'm physically eating it. And people say, I know that phrase they use, which I know you're on your lunch, but I sound like a bit of an old curmudgeon, but I feel like saying, so you recognise I am on my lunch, but you're still going to ask me anyway. I wouldn't dream of doing that to somebody else. I just wouldn't. If I see people eating their lunch, even if I've gone to speak to them, even as a chief exec, I come away, I walk past. I think I'll come back and I'll ask you this afternoon or tomorrow. So I think it is your lunchtime. And so I've found, to me, for me, practically, I've had to leave. I've had to go to the shops. And so even though I don't like shopping, I've got to get out because otherwise I don't get the time.
Maybe I'm going to write on a piece of paper, out to lunch, and drop it over the back of my screen.
It probably won't make any difference. It probably won't make any difference because for the people that you're writing that note for, they don't pay attention to those sort of things. There are sort of social cues, aren't there? And that's one of them of like, if you sat there, doing that, you wouldn't ask someone, but some people are not, I just ignore that sort of stuff. I think because you're there, they assume you're working all the time, which I think is wrong.
Grand. Okay, I'm conscious it's nearly past, and in the essence of having time to grab a brew and change, I think we probably need to draw it to a close there, I think. But really interesting, and thanks, Neil, for sharing your thoughts and giving us some some starters for thoughts and conversation. So thank you for that.